Only Catholic schools.
Maybe Forest, we can start slowly. So I think only 40-50 people have joined on YouTube. Thought we'll wait for at least 100 to join in. But maybe we can start slowly. I think people will join in.
Good afternoon, all and all, on this important occasion to commemorate the 4th anniversary of the Ayushman Bharat Health and Wellness Day. As we are all aware, Ayushman Bharat Health and Wellness Centers were launched under the Ayushman Bharat program in a bid to move away from selective healthcare to a more comprehensive range of services spanning across preventive, promotive, curative, rehabilitative, and palliative care of all the age groups. The National Health Policy of 2017 envisioned these centers as the foundation of India's health system. The centers deliver a range of comprehensive health care, like maternal and child health services, to address the population, including both communicable and non-communicable disease. Services for the elderly and palliative care are also the integral part of these health and wellness centers. In order to address the out-of-pocket expense of the patient and the client attending for health service, Ayushman Bharat Health and Wellness Centers provide free essential medicines and diagnostic services, as well as teleconsultation and health promoting, including wellness and yoga. Today, to mark the 4th anniversary of the Health and Wellness Day, the theme for today's event is eSanjeevani Health and Wellness through teleconsultation. So on this occasion, I would further, as we wait for the participants to join in as well, I would like to request I would like to welcome all the dignitaries who are present in today's program. First of all, I would welcome Madam Dr. H.C. Lindem, who is with us here, the Director of Health Services, as well as the Joint Mission Director NHM, all the state nodal officers present. And we are also very pleased that our respected Mission Director is also with us as a chief guest. We welcome you, sir, to this occasion. And without any further ado, I would like to request Madam Lindem to kindly present the progress of the Ayushman Bharat Health and Wellness Centers as on today in the state of Meghalaya. Thank you.
Thank you, Flourish, for chairing this event. The chief guest of today's function, Sir Ramkumar, our Mission Director, from IBA, SPM of the National Health Mission, and to each and to everyone attending this program. A very good afternoon to all of you. We are celebrating the 4th anniversary of the Ayushman Bharat Health and Wellness Day, the theme of which is eSanjeevani HWC Health and Wellness through teleconsultation. Yes, we have not been able to celebrate this day for the past 2 years because of the COVID-19 pandemic, but we are very happy we are able to celebrate this occasion today with the highlight of today's being the awards that will be handed to all the performers and to all the achievers. Teleconsultation is a platform which facilitates a patient to consult a doctor or a panel of doctors for the ailments, and in turn the doctors can advise and prescribe medicines for them. It is also a doctor-to-a-doctor telemedicine system. This facility is provided under the Ayushman Bharat scheme, Government of India, to health and wellness centers. I'll be giving a very short presentation on the progress of Ayushman Bharat Health and Wellness Center.
Thank you, Madam, for the kind presentation on the status of the Health and Wellness Center in the state of Meghalaya. I would like to request Barakshan to kindly run the slide just for the benefit of the all the participants attending the program.
Ayushman Bharat Health and Wellness Centers, transforming comprehensive healthcare in Meghalaya. The Government of Meghalaya, the National Health Mission Government of Meghalaya, with the partners USAID, NISHTA, and 𝘱𝘱𝘱. Why we invest in comprehensive primary healthcare? Selective primary healthcare, RCH, is focused, addresses only 20% of healthcare needs. Low utilization of public and health facilities, utilization of only 28% in the rural areas and 21% in urban areas. Epidemiological transition, 4 major non-communicable diseases account for 60% of all deaths in India. There's a loss to the economy that is 6% of India's GDP, social and national security. High return of investment. One invested in PHC saves $1.30 in health. The Ayushman Health and Wellness concept. The expanded packages of services where we have the ENT and the eye services, the palliative and the elderly services, the NCD and the mental health services. Health promotion and wellness. Health and wellness is a process of supporting, training, encouraging a person, a group, or a community in the pursuit of well-being, which may be in terms of social, physical, emotional, occupational, intellectual, environmental, and also spiritual. The emphasis of health promotion and prevention is designed to bring focus on keeping people healthy by engaging and encouraging individuals and communities to choose healthy behaviors, to make changes that reduce risk of developing chronic diseases and comorbidities, reaching the last mile and ensuring continuum of care. For example, patient discharge will be taken off till he or she reaches home, and always there will be a communication from the side of the healthcare provider. And the concept of a team-based approach, at the CHC level, we have the medical officers, the health and wellness nurse, and the A&M will be the team at the community health centers. The medical officer, the A&M, and the ASHA will be at the level of the PHC. Essential packages of services offered. Essential packages of services offered through Ayushman Bharat Health and Wellness Centers, RMN, CHA, and N, where we have 12 services listed here. Care in pregnancy and childbirth, neonatal and infant health care services, childhood and adolescent health care services, family planning, contraceptive services, and other reproductive health care services. Number 5 is management of communicable diseases, national health programs. Number 6 is the general outpatient care for acute simple illness and minor ailments. NCD, like screening, prevention, control, and management of non-communicable diseases. The expanded services are care for common ophthalmic and ENT problems, basic oral health care, elderly and palliative health care services, emergency medical services including burns and trauma, and screening and basic management of mental health ailments. The reach. This has been rolled out in 11 districts: West Garo Hills, Southwest Garo Hills, North Garo Hills, East Garo Hills, South Garo Hills, West Khasi Hills, Southwest Khasi Hills, Ribhoi District, East Khasi Hills, West Jhanti Hills, and East Jhanti Hills District. The number of facilities cumulative in Meghalaya are the sub-centers 400, where we have a target of 460, but it has been made operational 257. PHCs 114, operational are 95. The UPHCs, the target is 19, the operational is 16. So the target total is 593, operational is 368 with a 62%. The operationalization of health and wellness centers in Meghalaya for the financial year 2021-22. Sub-centers, the target is 240, the operational is 257. The PHCs, our target is 84, and the operational is 95. The UPHCs, the target is 16, and the operational is 16. A total of 342, where operational are 368. So here we can see it is 108% achievement. Also, we have two PSC's program study centers in Ganesh and Tura. Coming to the key achievements in strengthening CPHC. Operationalization of Health and Wellness Center. The state overachieved the conditionally target of 108 in operationalization of Health and Wellness Centers for financial year 21-22. 364 MLHPs in our state, we call them the Health and Wellness Nurse, are deployed at sub-centers and Health and Wellness Centers. 94 candidates are enrolled for January 2022. Integration of CCHC curriculum in BSc and BBSc colleges is completed. Integrated basic yoga training in the 6 months course for community health officers or zonal hub established and strengthened 11 district hospitals as hubs. 352 facilities are active on 𝘱𝘰𝘱𝘈𝘐𝑚𝑒 platform. Mental health and wellness nurse and staff nurses have completed the training on all expanded packages. Capacity building of health and wellness nurse and district officers on integrated TB services at Ayushman Bharat Health and Wellness Centers. Sputum collection at sub-centers, health and wellness centers has gone up from 0 to 67%. As of now, the total 312 health and wellness nurses are oriented on the same. Other achievements are capacity building. We trained 360 health and wellness nurses and ANMs of health and wellness centers on family planning, learning resource packages. CPHC orientation for district block officials of all 11 districts, which includes 5 newly added districts: East Garo Hills, North Garo, South Garo Hills, Southwest Khasi Hills, East Jangi Hills district. Refresher trainings on health and wellness centers portal and team-based incentives for all 11 districts. Oriented and trained district block officials, health and wellness nurse on eSanjeevani portal. Created a pool of district trainers for health and wellness nurse and staff nurses on kangaroo mother care interventions. Developed recording formats for health and wellness centers like NCT follow-up wellness registers, teleconsultation registers, uniform prescription slips and referral cards, etc. Also developed and shared the wellness calendar for health and wellness centers with the support of DP, NISHTHA and 𝘱𝘰𝘱𝑒𝑚. Saving lives, improving health, transforming futures is the overall objective behind the concept of the Ayushman Bharat Health and Wellness. Thank you.
A very big thank you to Madam Director and Joint Mission Director NHM, Madam H.C. Lundam, for the overview of the objectives of the comprehensive primary healthcare program in Meghalaya, and especially highlighting the various activities that have been rolled out in the state in order to ensure that all these Ayushman Bharat Health and Wellness centers are operationalized with expansion of services packages, emphasis on the wellness as well as a shared continuum of care. Now we move on to the next agenda, which is the most important and a special attraction of the day. And I believe that all our team at the district, the block, and at the field level are eagerly waiting to see this particular event, especially when it comes to award and recognition. We are very much grateful, and actually I would say that we are much proud of all the teams at all levels who have done their level best to ensure that we reach a target and ensure ensure that services are provided in the to reach the desired outcome and expectation of the people. Now we will jump right away to this agenda, and that is by calling the names and the contenders, the awardees of all the categories of the various category of this Ayushman Bharat Day. Now I would like to take this opportunity to to call the names of the best performing district as per the Health and Wellness portal, which have been recorded in the year 2021-22, and without without any particular order, I would like to call the name of the district. The first district that is awarded for this program among the top performing district, the first West Khas Hills. I would like to request Balbert to kindly display the award and the certificates for these performing district and the other category of awards. So let us just give a round of applause for the exemplary performance under the Ayushman Bharat Health and Wellness Center for the year 2021. Next district is West Gendhill district. Among the top, and in no particular order, West Garonese district is one of the top. Now the second award is under another criteria, and that is called the most promising district. And these three districts, in no particular order, I would like to call the name. First is Gendhill district, and the next award goes to Southwest Garonese district, North Garonese, and of course Southwest Garonese district. Now to continue on with the award ceremony, I would like to call upon Annie and my team from CPC to read out the remaining awards of the day.
Thank you, Kong Flourish. So the next set of awards is for the top facility Health and Wellness Center PHC level for conducting the maximum number of teleconsultation through eSanjeevani, and that goes to Trikikula PHC, which has conducted 28 consultations during the financial year since inception, that is 2020, and up to 2022 April. The second category of award goes to the top Health and Wellness Center, Urban Health Center, which has done maximum consultation again during the period April 2020 to April 2022, and that goes to Umsosun UPHC, which has consulted 44 consultations. The next category of award goes to Health and Wellness Center Sub-Center level, again for maximum number of teleconsultation conducted through eSanjeevani, again during the period April 2020 to April 2022, and that goes to Pinthor Sub-Center Health and Wellness Center. This facility has facilitated 148 teleconsultations through eSanjeevani platform. The next category of award goes to the Best Health and Wellness Nurse of the Year, which goes to Ms. Tailang Makamar from Southwest Garonese District, who is currently serving at Okarapara Sub-Center. Congratulations. The next category of award goes to the Best Performing Health and Wellness Nurse for facilitating maximum number of wellness sessions during the period April 2021 to April 2022. That goes to Ms. 𝘱𝘱𝙁𝙁 𝘿𝑞𝐻 from Kursai Sub-Center Health and Wellness Center, and has conducted 188 sessions during this financial year. The next category of award goes to Best Performing Health and Wellness Nurse for conducting maximum institutional delivery. Since the inception, they have conducted 133 institutional delivery at Sub-Center Thyroid Subcenter Health and Wellness Center and the East Khasi Hills District, and that goes to Mr. Nangpei Raji. And during this financial year, they had conducted 40 plus institutional deliveries. And the next category of award, which is jointly shared by Mr. Nangpei and Mrs. 𝘱𝘰𝘱𝘈 Masar, who is also serving at Thyroid Subcenter as ANM and has conducted institutional delivery along with Mr. Nangpei from Thyroid Subcenter, East Khasi Hills District. The next category of award goes to Best Performing Health and Wellness Nurse for outstanding performance during the 21-day TB campaign, that is April 2021 to April 2022, and that goes to Ms. 𝘱𝘰𝘱𝘈 from Pahambir Subcenter. The next category of award goes to the Best Health and Wellness Center for achieving maximum number of coverage in NCD screening during this financial year, and that goes to Umsaw Nongharai Subcenter under Ribhoi District. Read out by Ms. Frida.
Okay, thank you, Komani. I'll be reading out the names of the analysts and specialists who have made their contribution towards eSanjeevani Tele-Consultation. So we have Dr. Victor Nongbre.
Whoever is reading, it should be louder. It's not clear.
Okay, the commendation award is provided to the MOs and specialists who have made their contribution towards eSanjeevani Tele-Consultation. So I'll be reading out the names as follows. Dr. Victor Nongbre. Dr. Bakupar Suting. Dr. Bansidor W. Dr. Kerlin Miesel. Dr. Amika Jul Rinja. Dr. Kedamika Prutu. Dr. Sophia Shulai. Dr. Iman Haka Shamang. Dr. Cassie Mirvi Lamin. Dr. Larry Dashisha Wanyam. Dr. Vishal Ramsa Marak. Dr. Dulcie Makri. Dr. Shisha Khadithai. Dr. Bhabiti Rendatyam. Dr. Shindam Shilla. Dr. Bunda Katpangstian. Dr. Daka Hipaya Biam. Dr. Bolan Samba. Ashok Kumar Roy. Dr. B. Soklet. Dr. Dinil Joshua. Dr. Dorothy Joshua. Dr. Paul Francis. So, I would also like to appreciate the contribution made by �ՀWC through the Department of General Medicine, radiologists, pediatric, obs and gynae, dermatologists, and ENT for their valuable services provided through the eSanjeevani Tele-Consultation. Thank you.
So a very big congratulations to all the top performers, achievers, and promising district as well for the awards of today. And we would like to, and I would like to thank Andy and Frida as well for joining in reading out all the awardees. Now we would like to come to the next agenda, and that is the release of posters and a short promo on teleconsultation that has been developed at the state level. So kindly play the posters as well as the video.
Do you know that you can consult with a doctor without traveling far to the hospital? Yes, you can walk in to your nearest health and wellness sub-center in your village. Well, this is possible through teleconsultation services called eSanjeevani. This service is available in all government health and wellness centers. And you can consult with the doctors and specialists through mobile phones and technology. Your health needs are solved with just a click of a button. Hurry! Visit your nearest health center and get your free consultation with doctors. Issued in public interest by National Health Mission, Department of Health and Family Welfare, Government of Meghalaya.
I hope that video will be made quickly in the local languages also. Tasik around an hour at least.
Well, thank you, Albert, for playing the video, which is a mark as a mark of celebration. And henceforth, we are going to publish the video across all our media channels, and the same video will be translated in all the local language of the state as well. Now, without any further delay, we are very glad to have with us respected Sir Ramkumar, our Mission Director in our midst, who is the chief guest in this on this day as well. And I would like to request you, sir, to kindly share your valuable inputs on this very important day.
Thank you, Flourish. Good afternoon to our Joint MD and Director of Health Services MCH and our nodal officers who have joined for various programs. I'm very happy to be here today, and we wish we could have had a grand offline event where we could have called all the winners and etc. But given the day today and being a very holy weekend, so we thought we will do an online program, and it will also be a little befitting to the theme of this year, which is on teleconsultation. Our DHS MCH has very nicely made a presentation on the purpose of CPHC and where we are looking at, what is the point of it, and etc. All of them are already looking at it. So, I mean, as I keep saying this point again and again every day, the CPHC component for among all the states suits mostly for Meghalaya even better. CPHC, in a way, we were seeing a small video on Costa Rica. In Costa Rica, the state is also almost like Meghalaya, only 50 lakh population, very heavy rains, good greenery, very beautiful location. They do a similar CPHC program whereby the health worker reaches out to all the families every year. They do 2 visits family every year, and once someone has been identified as very having health issues and etc., they are personally monitored, and the longevity of the average citizen has gone to 85 plus years. They are not a very greatly developed country with great medical colleges or anything, but they have developed a system where their investment is in the primary health care, not in building multi-speciality hospitals. They have built small clinics which can work in all the community levels and etc. That is the model they have got, and the most important thing is their total out-of-pocket expenditure per person per year is $26 which is close to less than 2,000 rupees. That is the achievement they have made. Their out-of-pocket expenditure in Meghalaya, Northeast, of course, the out-of-pocket expenditure is more than 55%. Of the Northeastern states, Meghalaya's out-of-pocket expenditure on health is more than 65% in terms of their overall health expenditure. The overall health expenditure in our state runs in thousands, if not in lakhs for some few families where they have chronic issues. Very, very strange situation. So in order to avoid that, this is the great chance which we have to reach out to every single family with a positive healthcare management system. So we are happy that we are making a lot of progress in that in terms of opening health and wellness centers. But as we mentioned, awards were given not only for health component but also for wellness component. We need to focus a lot on wellness. In the coming next 2 years, I hope we will make our best efforts in getting this wellness component done. One of that initiative of both health as well as a little bit of wellness is our teleconsultation, which has been started. The teleconsultation, I mean, last entire year we had made at least, I think, 10 teleconsultation or something like that. And thanks to the team effort here, I would like to really mention our nodal officers, Dr. on bill today, Dr. Nongbri, our state program manager, Ms. 𝘱𝘱𝘈𝘐𝑚, 𝘱𝑒𝘠ℎ, Mr. 𝑘𝑚𝐻, our team here with Frida and Jamsha, all of them, including the ground team, every single MLHP has put a lot of effort to get teleconsultation activated, particularly in a state like us where network is a problem, where continuous network is a problem, electricity is a problem. We have got already photographs of seen many instances where under the tree teleconsultation is done, outside the PHC teleconsultation is done, in a small hilltop the teleconsultation is done, inside the forest teleconsultation is done. But ultimately, we would like to tell that a poor patient in a village meeting a doctor for free at doorstep level, that is a game changer. Today, we have already, I've seen the dashboard today, we are close to 500 teleconsultations. The maximum teleconsultations, I think, per day, I think has been achieved today, which I think is more than 460 plus teleconsultation. I really would like to congratulate each and every MLHP, CHOs, MLHP, ANMs, the doctors on the hub who are there, the team which had looked into putting up the entire ECRP and through which we are able to get this activated, getting the laptops in place. Really very good work, but we still have a long way to go. Because in a state like Meghalaya, where you have to travel a long distance, even though it is only 10 kilometers, 15 kilometers, you have to travel a lot of time to go and come and etc. Many of them are day laborers. They can't leave their wages one day, 2 days. They will be thinking, if I go today, I'll not get money, so let me not go, and the kids keeping postponed. And what happens is our average lifespan in Meghalaya has come down to 62 years, where average lifespan in India is 68 years. For Southeast Asia, it is close to 70 plus years. For Europe, it is 85 plus years. The Costa Rica, which I explained, is 86 plus they have touched. So we need to look into increasing the lifespan. Even if we increase lifespan on average by 2 years for every individual, which means that we are getting 8 million, that is 80 lakh extra years. We have 35 million population, the 3.5 million population, 35 lakh population. We can add 70 lakh man years for the entire state. Imagine the amount of productivity. If we want to become a flourishing, developed, prosperous state, this active, healthy population is very important. We can't have a population lining up in hospitals or dying without knowing what are the consequences of it. So this is a very, very important point I would like to insist here. I request everyone to carry on with this approach of not giving up till the last objective is achieved. So we reach teleconsultation to a very deep level is very important in terms of filling our CBAC forms and having a positive healthcare system where we proactively reach out to the community and find out is very important. And we are very happy this year we have launched the village health councils, which is going to be an extremely integral part to CPHC particularly. These village health councils, where we are going to start the training now, we are going to have a village level health body. You might ask, we already have VHSNC. Why do we have VHC now? Now, VHSNC was a committee of people, but VHC will be an elected body. We will be even doing a lot of small infrastructure works which can be done by a VHC, because through VEC we do a lot of infrastructure works. So through VHC also we can achieve that small amount of infrastructure works. We would like community to own it up. In fact, thanks to our secretary, Madam Kurba, she had come up with a very interesting idea in a conversation. Why can't each village health council have a village health registry? Like we have a health and wellness register at the sub-center level. Why can't villages have their own health register? That these are the number of people are there. They are born. They are this thing. This is the age. These are the parameters they have to be seem to be having. Once in 3-4 months, they can update the register. That will be a very good task. They'll know, okay, who is their village and etc. Someone is saying chronic abdomen pain. I mean, last time also you said, why are you saying now also? So that if there is a continuous pain, why are we not actually intervening? The village can come together and think. Pregnant mother is there, and very teenage pregnancies are there, young multiple pregnancies are there. Why can't we save mothers, save delivery, save birth spacing? We need to, this council will be a very big thing. We can show the entire country an excellent model where community and the primary healthcare goes together. where community takes ownership and government also actively supports this ownership activity. We cannot think that, okay, as health department, we will do everything. During COVID, we have understood it doesn't work like that. The community COVID management team stepped up during the initial days where we had a lot of issues and managing quarantine, isolation, etc. They stepped up. We more and more we see to this. We more and more we understand that communities have to be actively involved in any or everything. Only then we can actually build the confidence. Today we have some confidence. In a way, I'm having none of them in the hall are wearing, there is no one feels the need to wear a mask because all of us are vaccinated, all of us are protected. We feel that we are confident to know what is COVID. We know how to handle COVID. That confidence brings in that kind of clarity. So this confidence should come to everyone in the community. Only then, through this pandemic, we might have learned something. Otherwise, if we again go back to a system of building hospital, putting people in, etc., it is a supply mechanism. That means that government does everything. So people also will think if some issue comes tomorrow, government will come to help. It should not be like that. We create a village health council where people also take up the issue. Yes, we need healthy population in our village. Otherwise, our village land is going to shrink. Some other villages are going to come and take the lands and etc. because our people now, not many number of people are there to work. That should be the level of ownership, and then we support that kind of initiative. In this year, we have given hemoglobin meters to all the ANMs. Laptops have been given for teleconsultations. The HB&C kits are also being given. New RBSK kits are coming. A lot of small things have been done, but ultimate objective for us is to ensure that the lifespan of an average Meghalayan is at least increased by 10%. Until we do that, we will not be able to completely relish the happiness of launching a very excellent CPHC program and into the benefits of it. So with that, I will hold here. In fact, one of the last points I saw in the presentation, what our DHS madam had made, was the involving of integrating TB into health and wellness centers. So that is exercise we have started, how to do the TB screenings, and that very closely. Next, in East Kasi Hills District, we're trying to bring, particularly with cancer screening, very qualitative cancer screening activities, because Meghalaya is one of the capital. Shillong is the state in national capital for cancer. It was one of the one of the capitals of northeastern, erstwhile northeastern province. But today, very unfortunate distinction we have of being the cancer capital for the entire country. So many incidences of cancer happens. It has been taken note by NITI Aayog, World Economic Forum, USAID, everyone. And we are trying to put in a program where we will address this at the CPHC level. So CPHC is going to be the future healthcare model, where we are going to invest a lot in primary healthcare so that we need not invest heavily in the tertiary care. For a simple example, if any state, so in Meghalaya, we procure medicines up to 100 to 120 crores. 30 to 35 crores goes only for cancer treatment. How many patients are treated for cancer? A very, very small number when we compare to the larger number. So all our resources goes like that. So we need not go like that, and we can actually control this and economically develop and socially also develop if we can focus on this program a lot. So a lot of change has happened this time, nodal officers, etc., in terms of CPHC program. But next 2 years, particularly next 1 year, would be extremely important in taking this program ahead. So I really would like to wish everyone a very happy Health and Wellness Day of this, 4th anniversary. And I also wish you all a very happy Easter weekend. We are going to strive very hard, and our MLHP-CHOs are the backbone. Are slowly but steadily, the ANMs and MLHPs are becoming the backbone of our entire healthcare system, which is very, very heartwarming. And we need to ensure going forward that we bring the community also and strengthen this backbone of the entire state's healthcare systems. So thanks you for the opportunity. I wish we could have had a big program, but I really hope next time we don't have pandemic or anything else. Next year we would like to do a big program, and we would like to call all the, if possible, at least in a 2-3 days staggered manner. We can like to have in different places all the MLHPs, and a very nice program. I really would like to congratulate everyone for taking this step forward, and we hope we'll be able to achieve together a lot of things in the coming years. Thank you.
Thank you, sir, for such an inspiring and wonderful speech. You have been an icon and for the health system, sir, especially with your passion towards improving the healthcare system and most importantly, the comprehensive and the promotive part component of the primary healthcare services. It is very encouraging, sir, on your speech you have mentioned about the importance of convergence in thought and action with all programs and especially with the community in order to optimize the resources and to create a synergy in the system in both urban and rural areas to ensure quality and efficiency services for the benefit of the people of the state. Thank you once again, sir. And without any further ado, I would hereby request Madam Ibamonlang Nongbri, who is also a state program manager, to kindly deliver the word of thanks on this occasion.
Thank you, Kong Flourish. On behalf of the Department of Health and Family Welfare and National Health Mission, I'm honored and privileged to be able to deliver this vote of thanks. At the outset, I would like to thank our chief guest for today's program, also our mission director, Sir Ramkumar. Thank you, sir. You've been instrumental in every way. If I talk about the National Health Mission programs, I have Kong Flourish has mentioned your passion in improving healthcare to achieve up to the last mile is really amazing, and we are only encouraged and inspired by you when we work with you on a daily basis. Thank you, sir. Also, I would like to thank a Joint Mission Director, National Health Mission, also the Director of MCH&FW, Dr. Lindem. Thank you, ma'am, for your presentation and also for being with us here today. And also, special thanks and gratitude goes to the CPHC team, because without them, this program today will have not been a success. Kong Flourish, Kong Annie, Jam, and also Kong Frida for taking it forward, for being there at every step of the way. Also, all the other team members of this SPMU team who have contributed, each of you have contributed in your own way in making this program a success, not only for today and also in ensuring that teleconsultation services is actually happening now in all our sub-centers, which I think so last year, if you go backwards, compared with last year and this year, you could have never imagined to achieve what we are today doing, especially to be doing more than 460 teleconsultations. This effort all goes to the district team, especially the MLHPs at the sub-centers, who has been driving, who is the backbone and also the driving force for the teleconsultation services, and also all the doctors at the hubs who are constantly alert and following up and telling them that you have to close the call today if if the call doesn't get closed, so that they can do the data entry at the eSanjeevani platform. Thank you so much for all your efforts. What we are today is because of you all, that you all have tirelessly worked and effortlessly. And last but not the least, this program today will have not been a success, especially for all those achievers who have achieved today on the different categories, which was highlighted by Kong Annie and Kong Frida, on the different categories which they have won, especially for the performing, promising, and also for teleconsultation. A big congratulations to all of you. And last but not the least, I would like to give a round of applause for all the team, whether at the district level, MLHPs, at the block level, at the field level, and here at the state. Let all of us give a round of applause for all our achievements, which we have worked very hard. Thank you.
Thank you, Kong Iba, for the wonderful word of thanks. We are indeed delighted and feel appreciated, I think, to have achieved this milestone on this 4th anniversary of Ayushman Bharat. Let us all pledge to contribute endlessly towards the progress of the healthcare system in our state at any level that we are being assigned to. Thank you, and have a nice day, everyone. Thank you.